In this lecture, we will study occipital artery, posterior auricular artery, and superficial temporal artery. Of course, I will not go into the detail of maxillary artery. I will make a separate lecture for that. So, okay, the occipital artery. Now, this occipital artery arises from the posterior aspect of the external carotid artery, just opposite to the origin of facial artery. So in front there is a facial artery going on, and in opposite the posterior direction occipital artery is going on. So it is crossed by hypoglossal nerve at this point. So at this point it is crossed by hypoglossal nerve, right? It will give off branches sternocleidomastoid, I will tell you. Okay, so one of the important question you have to note down that this occipital artery is in strong relationship with the lower border of posterior belly of digastric muscle. Yes, it comes in MCQ. You have to note it that posterior belly of digastric, the lower border, is related to occipital artery. Upper border is related to another artery, I will tell you. So I am making the sternocleidomastoid branches of the occipital artery. So right, these are the sternocleidomastoid branches of the occipital artery. You have to remember about the lower border, the posterior belly of the digastric. It supplies occipital artery chiefly after coming out from the, yes, it goes deep to the mastoid process, and it supplies muscle which are attached to the mastoid process, right? We are talking about sternocleidomastoid muscle, digastric muscle, splenus capitis, longus capitis. Okay, so fine, you have to learn only the sternocleidomastoid and digastric, the posterior belly, which are joined to the mastoid. So you have to note that. Now what this is, which I had made, is the posterior auricular artery, and I want you to learn that it is in strong relationship with the upper border of posterior belly of digastric muscle. So it is just above the upper border of the posterior belly of the digastric muscle. It will supply back of the auricle, skin over the mastoid process, and yes, one of the branches from it will enter into the stylomastoid branch, stylomastoid foramen, and will give stylomastoid branch, which will supply middle ear, mastoid antrum, and the ear cells, and of course the semicircular canals. So these middle ear, mastoid antrum, mastoid ear cells, semicircular canals is supplied by this posterior auricular artery, which I had made. Okay, so you have to learn this MCQ. The upper border of the posterior belly of the digastric is in strong relation with the posterior auricular. So this is the external auditory meatus. From posterior side it is supplied by the posterior auricular, but anterior side it is supplied by the superficial temporal artery, right? Now we are heading onto the ECA, and now I termit this ECA. This is the terminal point of the ECA, from where this is the maxillary artery originating and the superficial temporal artery which is originating. Remember, the maxillary artery and the superficial temporal artery, they are origin where? Just deep to the neck of the mandible, right? Where the condyle is joining to the ramus is the neck of the mandible, or to that deep part of the neck of the mandible our maxillary artery is originating. One of the MCQ question. Okay, so you have to learn. Of course, I will take a separate lecture on the maxillary artery. It is our 7th branch of the ECA. We had talked about occipital, which was 5th, posterior auricular, which was 6th, and yes, 7th, which was maxillary artery. And yes, I will not go into the detail. This maxillary artery has 3 parts, almost 15 branches. And yes, it is heading forward. I will divide it into 3 parts in this video. Yes, I will divide it. The first part, which is known as mandibular part. This is the last part, which is known as pterygopalatine part. And yes, from this pterygopalatine part 6 arteries generate, and this pterygoid part 4 arteries are made, right? And this is the first part, which is known as the mandibular part. I will not go into the detail now. So we have 3 parts. It is chiefly divided by lateral pterygoid muscle, right? So when you will see, you will remove the ramus, and when you will see the lateral pterygoid muscle, its 2 heads, right? And yes, insertion into the articular disc. This lateral pterygoid muscle will divide this artery into three parts. It's an MCQ question. Okay, so this is the lateral pterygoid, okay, plate. For bones which I have told you, you have to go for pharynx anatomy video. I have told every bone and every structure which I am representing here. This is pharyngobasilar fascia which I am writing. This is pharyngobasilar fascia. In this pharyngobasilar fascia, our first part, 5 branches arteries are present, right? So our first part is mandibular part, because its main and the long division is inferior alveolar artery. That's why it is designated as mandibular part. I'm not going into the detail. I will take a separate lecture for this maxillary artery, right? So this is the first part, second part, third part. Yes, okay, I was telling you the lateral pterygoid muscle. When you will see the lateral pterygoid muscle, actually it has two heads, right? So, and one insertion into the articular disc. When you will see the lateral pterygoid muscle, you will see this artery is present above this lateral pterygoid muscle, and it is divided into three parts by the lateral pterygoid. It's one of the MCQ question, you have to remember this. These are the pterygoid part, second part, and yes, third is the mandibular part, sorry, the pterygopalatine part, which will give off 6 branches. I will talk in detail in, I think, next lecture I will talk of maxillary artery. So this is the pterygoid palatine part. Okay. So now we will head again to our superficial temporal artery. So the superficial temporal artery, which is also the terminal branch and is a smaller terminal. Of course, maxillary artery has 15 branches. It is long. So smaller terminal branch is our superficial temporal branch, superficial temporal artery, and the superficial temporal artery also arises at the behind the neck of the mandible, same as the maxillary arise. It is the point where superficial temporal arise, and both these terminal branches are behind the neck of the mandible. I am talking to the area where condyle joins to the neck of mandible. Now this superficial temporal artery divides into two branches, anterior and the posterior branches. Now the anterior and posterior branches which divide, we can felt pulsation over here. This point is where the pulsations are felt of the superficial temporal artery. Right at this point we can felt the pulsations, right? About 5 centimeter above the zygoma, it divides into anterior and posterior branches, right? Pulsation felt over here, and anterior external auditory meatus is supplied by this superficial temporal artery. It will divide into anterior and posterior border above about 5 centimeter of the zygoma. Meanwhile, this superficial temporal artery gives off many branches. Let me tell you. Number one, it will give transverse facial artery. Now, you have to remember that this transverse facial artery will supply lateral face. So, this superficial temporal artery supplies temples, scalp area, auricularia, anterior auricular. And now, what I am want to show you here is, okay, I am writing the anterior division. I will also write the posterior division. What I was telling you about the transverse facial artery, that it will supply the lateral face. So MCQ question, which is the terminal branch of the ACA, are superficial temporal and the maxillary artery. Okay. So now this branch which I want to make is what I told you is the transverse facial artery. It supplies parotid gland, not TMJ. Remember, it's an MCQ question. Then it lies on the masseter, inferior to zygomatic branch of facial nerve and superior to parotid duct. So it supplies both of them, facial nerve, also parotid duct. Middle temporal artery is a branch of superficial temporal artery. Okay, so we have two pairs of middle temporal artery, both side two pair. That means total 4 middle temporal arteries we have. What about the anterior temporal and posterior temporal? Okay, right. I will tell you that anterior temporal and posterior temporal They are also known as deep temporalis artery. They are branches of maxillary artery, which I will cover in next lecture. Now this which thing I am making is two pairs of middle temporalis artery. So middle temporalis, we have two pairs. They will supply middle temporal muscle, and yes, the fascia over that, the temporal fascia and the temples area, right? Middle portion, not the anterior and posterior. Anterior and posterior temporalis is the branch of deep temporalis artery, which is the branch of second part, the pterygoid part of the maxillary artery. I will not talk right on the maxillary artery. I will take another lecture for that. These are the two branches which are heading towards the middle temporal region, right? So middle temporalis artery. Okay, so we had discussed now about the occipital artery, we had discussed about the posterior auricular artery. Yes, of course, we had discussed some portion of the maxillary artery and the superficial temporal artery I have discussed in total. So now this lecture was only for this external carotid artery, which has finished after these 8 branches. You can also see the first part which I made, in which our 4 branches are discussed in the first part. Then I will head towards the nerves. I will tell you about the nerves. And yes, I want to tell you here that this is the supraorbital, and yes, this is the supratrochlear, and supratrochlear medial side, supraorbital lateral side, anastomosing. Both of them are anastomosing with the anterior division of the superficial temporal artery,